And well, since Father's Day is this weekend, summer arrives, Father's Day arrives. It is Men's Health Month as well. So we asked our medical expert, Dr. Cedrek McFadden, to focus in on the guys today. We'll talk a little bit about coronavirus live at 5 tonight, but let's talk right now about the men and their health. What is it about men and their health problems, how they compare to women, for example?
Well, we have some of the same health problems, but men tend to find themselves with these problems earlier on, partly because women pay attention to the smaller things. And so perhaps, you know, while only 24% of men are seeing their doctor on a regular basis, women are going much more frequently than that.
Only 24%?
Well, you know, they're less likely to go to the doctor. And so what we're finding is that women are getting seen sooner with these symptoms of diabetes and hypertension and heart disease way farther sooner than men are. And so by the time men present, they're more complicated. They're in the hospital with these complications from pneumonia or diabetes or even heart disease. What
about testing? You know, what kind of tests should men not put off and make sure they're getting done to stay on top of their health?
Until you're the age of 35, most men don't need to regularly see a doctor, unless you're having signs and symptoms or problems or there's a family history. But once you reach the age of 35, at least every other year, you should be seeing a doctor for blood work, for cholesterol, for diabetes. By the time you're 45, you should be having your first colonoscopy. And by the time you're 50, you need to be starting screening for prostate cancer. These screenings should begin sooner if you have a family history or if you're African American. Those tests should begin much sooner than that.
And are there things that men can do at home if they're sort of reluctant to go to the doctor? Is there screenings or things they can make sure they're administering to stay on top of their health?
Or even between the interval, you know, a year is a long time to go to the doctor. You should be regularly doing at least 4 exams. You should be doing a skin check to look for cancer. So if you're seeing lesions that are new, different, enlarging, or changing in color, that's a sign that you need to be talking with your doctor. You could also be doing checks of the oral cavity, also doing testicular exams, and don't forget about breast cancer. Breast cancer still affects men, and don't forget about your weight. Your waist circumference can be an indicator of heart disease or diabetes. So if your waist as a man is greater than 40 inches, that could be an indicator or a risk factor for heart disease or diabetes.
And what is the best way to get men to go to the doctor? I feel like it's us, ladies, putting the pressure on them if you're a lady in a man's life, right?
Sometimes it's that. It's being an example, buying the right foods, you doing the right things. But in addition to that, it's perhaps scheduling that doctor's appointment at the same time as yours. That's one way to encourage them to get there. In many cases, men don't go to the doctor with their children. That's generally a mom's job. But if you have a man in the life that is hesitant or fearful of being a doctor, that low-risk scenario of taking the kids to the doctor may introduce them into that. And really be careful of nagging or, you know, overly guilt-tripping, because that doesn't really work with men.
So just maybe the buddy system. Hey, honey, let's make our appointments.
Buddy system, and actually making that appointment makes it easier to go, because that's one less thing they have to do.
Hey, I made your appointment for such and such.
Made your appointment, this is when you show up. Yes.
Clear your schedule.
And be there.
Yes. Dr. Cedrek McFadden joining us to answer coronavirus questions. We're going to have a lot of them with this new 987 cases announced today. You can go to the WSPA Facebook page, post your questions. We'll answer them live at 5. You're watching Carolina's Family at 4. We'll be right back with more.